Well, we've got a great session here on how the sharing economy can help cancer patients. And here with us, we have Kristen Berlacher from Airbnb, Dave McLaughlin from WeWork, and Gyre Renwick from Lyft. And thanks for being here, guys. And let's get started. So, Kristen, you guys have a program you're announcing today. One thing we don't think about cancer treatment is it's actually very hard. It often involves a lot of travel. People go to places to get treated and don't have somewhere to stay. Yeah. And you've got a bit of a solution for that. Tell us about this.
We do. We're so excited today to be expanding our Open Homes program, which is a platform that allows hosts around the world to open their homes for free for people in need. Previously, this program focused on housing needs for refugees as well as those displaced by natural disasters. And today, we're so excited to announce that we'll be supporting the housing needs of medical patients and their families who need to access either treatment or even recovery. So that's something that we're really delighted to share and hopefully get more folks involved to join us in this, because it really is going to take a community.
And I mean, you've already been doing work with the Make-A-Wish Foundation. I mean, I think people who were here this morning got to briefly meet a wonderful woman who I got to talk to last night who got to go to Paris when she was 15.
We have. So we've been working with Make-A-Wish for almost 3 years now, and just this month granted our 1,000th wish together. So helping families have a warm, welcoming place to stay when their kids get to go out on their wish experience. And today we're really excited to be expanding beyond Make-A-Wish to also include leaders like Fisher House Foundation, as well as an organization called Hospitality Homes. So these are partners who will help us identify families and patients in need of housing for treatment.
Gyre, I got to tell you, when I order a Lyft, the last thing I think about is healthcare, and I think about healthcare almost all the time. But it actually turns out to be a pretty big part of what you do, and there's a lot you think you can offer here. Tell us about how Lyft is connected to cancer.
Yeah, so Lyft has really made an important pledge over the past 2.5 years, really to try to solve healthcare transportation across the ecosystem. And the cancer patients that we serve today, it's incredibly powerful to look at what the impact transportation can have on those individuals' lives and the quality of care they receive. Today, around 3.5 million Americans miss appointments every year due to a lack of transportation, and the downstream healthcare costs that are significant. It's estimated to cost around $150 billion of downstream costs for those patients. And on top of that, the quality of care they're
because
actually
people aren't making it to their appointments.
People don't simply. Frankly, it's a relatively simple solution. It's how do you help those individuals get to the care they need, and how do you take that burden off of even the family members and the caregivers to help that person have the independence while they're going through treatment programs and ultimately receive better care as a patient.
And so, Dave, you guys are announcing a commitment as well. And for all the science we talk about, there is this limitation that we need places to do it, right? So talk a little bit about what you're doing.
Sure. You know, WeWork, we have almost 300 buildings in 70 plus cities around the world. And so today we're announcing that we're introducing Cancer Collaboration Hub Spaces, where just like this conversation that we're all here for today, the power of bringing the conversation together, bringing people together, who are working in similar spaces and can share inspiration, but also, real tangible learnings that are relevant to one another. We see that happening on a local level. So we have these initial 3 collaboration hubs that we're launching, one in New York, one in Boston, and one in San Francisco. The one in Boston, I was a little closer to setting that one up, and it's a great story. It's a serial entrepreneur named Michael Hayes, who is a throat cancer survivor and now has started an organization called cancerai.org, which is just, applying AI to cancer research and getting different looks at the data and so forth. And it's just a great example of the types of things that are going on that we can support by bringing them together.
And what exactly does WeWork do to make this a space for an entrepreneur like Michael?
Well, the biggest thing is in these cities we have very big communities. You know, in New York we have, I'm not sure the exact number, but I'll say greater than 40,000 members in WeWork. In San Francisco it's a big number. In Boston it's probably 7,500 or something like that. Within that, a community of that size, there are multiple people that are working on cancer from some angle or another. And so the first thing that we do is we reach into that and identify who those people are, and then we can kind of nudge them together so that they can start to collaborate.
how did you guys all start thinking about this? I mean, that this becomes a problem because it isn't the first thing we think of when we think of your companies, but there does seem to be a lot you can contribute. So how does this become part of your corporate identity? Kristen?
We knew that so many people have to travel for medical reasons, and too often the cost of accommodations can really be that barrier for access to treatment, like what you were saying. And on the flip side, we've seen our hosts demonstrate incredible generosity before we launched the Open Homes program, offering special discounts on our platform for patients that were traveling and just going above and beyond to make their homes a welcoming place while these families are going through such a difficult time. So it really bubbled up from the community and realizing that you don't have to be a medical expert to open your home and provide a welcoming space that's an escape from, the often sterile environment of a hotel.
And let's explain exactly what Open Homes does.
Yeah.
So what exactly is it that you're offering here?
So it's a platform that offers free housing, and anyone can get involved who has extra space that they want to share. And then we work with nonprofits who essentially identify and book housing for patients and families. And those nonprofits are also a phone call away for our hosts if they have any questions or needs.
So instead of being an intermediary for people renting out their home, you're an intermediary for people donating their home.
Yes.
And so it's possible that I could say, hey, I have an extra bedroom and I want to make it available specifically for this purpose, but I don't want to, for one reason or another, maybe I don't want to be an Airbnb host otherwise.
Exactly. Yeah. Many of the people on the platform for Open Homes are not regular Airbnb hosts, and they're just doing this for their own kind of personal philanthropy.
Gyre, how did Lyft start thinking about healthcare?
Yeah, so if you really go back to our mission as a company is about improving people's lives for the world's best transportation. And some of the populations we realized we were not able to touch are some of our most underserved populations. They were lower income, elderly populations that didn't have access to Lyft or didn't have a smartphone to even call Lyft. And so the solutions we're building are taking that burden out of the actual individual patients and putting it in the hands of the caregivers, the social workers, and the health payers to actually call those rides and book those rides on behalf of the patient. So the end user doesn't have to have any piece of technology and doesn't actually have to be paying for that transportation.
What about you, Dave? So what was kind of the reason here? I mean, I know you have a lot of, I visit biotech companies in your spaces all the time.
Sure.
Get a drink on the way out, So what is,
why visit them to get a drink? Is that
no, yeah.
I think we come from the same place, as these guys, which is to say we're a mission-driven company, we're a values-driven company. Yes, what we do is about office space and a community and a platform for entrepreneurs and nonprofit founders, people who need a place to work and a different way to work, just like what Gyre's team does is about transportation and what Kristen's does is about where people stay. But all of us come from companies that are very, very values-driven. And what we see in our community is collaboration drives innovation. And so when you get people working together and people who are coming from, you get all different size companies and different domains and disciplines and different proficiencies, things spark there. And so where we can take that and start to steer it towards something that really expresses our values and our mission, something that really can make an impact in a very positive way, that's easy.
So would any of you have advice for other companies that want to think about how they can get involved here?
Yeah, I think for us, as we approach the healthcare space, I think it was really important to work with the existing partners in that industry. I think that Lyft came in and I built this team really around trying to solve this problem, but we didn't do it alone. We went in and partnered with existing health systems, we partnered with existing insurance companies, and even done integrations directly into electronic health records. So we're really trying to work with our partners and really trying to solve this problem by bringing these different ecosystems together. So to me, I don't think as a tech company you can approach it in a vacuum without understanding the industry or working with the partners in it to be successful.
Kristen, I mean, you're doing a lot of partnership here too. Do you have any other thoughts on how to mobilize?
I think thinking what unique assets your business brings to the issue. So for Airbnb, that really is our community of hosts. We couldn't do this program without them. It's our technology, and it's really the idea that we have a platform that's already inherently built on trust that really helps facilitate kind of this matching for patients that need housing and hosts that are willing to open them. But every company has those unique assets, and so it's really just thinking about what is the unique piece that we bring to the table.
Dave, what about you? I mean, same question. What advice would you have for others thinking about how do I figure out what I can do?
I mean, I think that's pretty great advice, really, is you know, what is this issue that we want to try to move the needle on? And then, you know, let's try to fill a whiteboard with crazy creative ways that we can do it. And then we can kind of whittle that down and say which ones actually have the most impact and are most feasible. And again, where you're engaging, I think because we're all engaging big communities of people that are very varied in terms of their backgrounds and so forth, you just have a lot of reach. And so for us, that's exciting.
Gyre, you've been interfacing with the healthcare system in a lot of different places for a while. I mean, you're also involved in clinical trials and getting patients to try their medicines in addition to get them.
Yeah.
What have you learned from those experiences? I mean, it's often very hard for tech companies and healthcare to find a meeting place. They do mix like oil and water.
Yeah, I think first of all, I think we have to realize this is a different population than what Lyft's core customer is today. You know, the core customer for Lyft is very different than an elderly patient going through oncology treatment. And so the solutions and tools we need to build for them, as well as the way that we talk to our drivers to how do you interact with these patients, was incredibly important to us as well. I think it was important when we approached that space that we realized this is a different population and we need to have a different set of solutions to meet the needs for them. I also think it's really important as we worked in this space to not only show the impact we could have on individuals, but at an aggregate level, how are we actually creating a business case here where this is a transportation benefit that people need to be paying for and actually adding the value from a quality of care. So we're really excited because we have results showing that we're starting to actually decrease overall costs for these patients and early indicators of actually improving health outcomes over the past 2.5 years. To me, that's a really exciting opportunity where a business can come together to solve important societal issues, but then also economically be viable that allows us to expand as quickly as it has.
Kristen, what changes do you see as you move this from, I mean, starting with the Make-A-Wish patients, which are wonderful stories, and moving on to all these people who need to travel all these places in order to get their care? I mean, it's different. Do you think the program will work about the same way? Do you see new obstacles?
I think for us, it's what we're most excited for, and what the biggest change is just going to be the scale of the impact that we can have now that we've officially made this a part of our Open Homes platform. So the potential is as big as the community that we can attract and inspire to join us in this initiative. So that's what we're most excited about.
And Dave, what are the long-term goals? How will you know if this is working, this providing the space for people to work together like this?
Well, our business really operates, although it's global in scope, it really operates on a human scale because the community exists at the level of the individual building, and we have staff at the individual building level. So if we create a collaboration hub as we are in these 3 cities, we'll know because our staff is in the space, and our staff will be directly involved in terms of that engagement. But I think I love bringing the word potential into this because I think that's always kind of the cool thing. The way that we look at our business is you put people in a building together, sitting next to each other, interacting, and kind of what comes out of that. If we asked Vice President Dr. Biden, you know, what would they expect to come out of today, they wouldn't know because the possibilities are so much greater than, you know, what you could imagine. So how will we know if this is successful? We'll be in the conversation with the people that are using the spaces, and we'll see what comes.
All right. Does anyone have a final thought? We're almost up.
I mean, I'll just say, maybe on behalf of the panel, like, thank you to everybody here for all the amazing work that they're doing, and on behalf of WeWork, thanks to my fellow panelists for the work that you're doing. It's really inspiring, and we're grateful to be part of the conversation.
Gyre?
And I would just add to that, I think as we worked in this space, to me, it goes back to the individual stories and the patients that we serve. I've spent over the past 2.5 years seeing the impact on individuals' lives. To me, that's what's excited me about the job that I do. To me, it's also been really eye-opening how significant a problem this is. We've made a pledge by 2020 to try to drop the number of missed appointments down in half by the solutions that we have together. So to me, it's an incredible problem to solve. I think we have solutions that we can bring to this space, and it's exciting to be able to join the stage with these panelists because I also think there's opportunities, even we were talking backstage, how do we work together to solve these issues as a tech-based group here and bring that healthcare to the healthcare industry?
Kristen, do you have a final thought?
I would agree. So for Airbnb, our goal is to house 100,000 people through this program by 2022, and we, again, won't be able to do it alone. And I think earlier today, I was so inspired just hearing all the incredible personal stories of survivorship and just imagining how there's so many people who are affected by cancer. And so often I was just thinking of this feeling of helplessness. And there's so many real direct ways that people can really give back now and pay it forward through programs like this. And hopefully this initiative will help inspire people to take those actions.
Amazing. It's a great example of all the untapped potential. And I think that's really what the Biden initiative symbolizes. So thanks all of you for being here. Thanks all of you for listening. We're out. Thank you.